Watch on BBC iPlayer.
It is almost 25 minutes to 6 o'clock. You're listening to Evening Extra. Richard with you until 6. Let's return to our top story now, because most appointments and most scheduled surgeries in the Southern Health Trust area were cancelled again today, following on from yesterday's major IT incident. The Trust's medical director, Stephen Austin, he was on Good Morning Ulster and explained that the technology outage was caused by issues with the Trust's data centres.
There was issues with our data centre within the Trust, meant that our staff couldn't access the normal IT systems that they normally use to provide care. And it was safer for us to be able to cancel those surgeries to give our staff time to concentrate the patients we had within the Trust already. That was a data centre that stores the data that we provide into the Encompass system. We just couldn't access that properly. Encompass was working properly across Northern Ireland. That wasn't the issue. The issue is our staff being able to put data into that system and access medical records and investigations.
Well, if you're wondering what all that means, let's speak to Kevin Curran, Professor of Cybersecurity from Ulster University, who's here to talk us through that. I mean, Kevin, just in terms of the explanation we've had so far, I mean, how unusual is it for something like this to happen, that we have IT systems going down and backups failing?
Well, it's not par for the course, but and we only get to hear about the ones which fail and fail big. And in this case, it seems to be that it's the data centres. So whether or not the trusts have like their own private cloud with maintaining their servers and the building and everything else, or they have it in public cloud, and public doesn't mean any more less private. Actually, it's all to do with how you configure the systems, whether they're in a private system or in a public system. But and at least in this case, we're not talking about a ransomware attack or some cyber crime. It just seems to be a failure of whether it's hardware or software, which it could only be either. Somewhere along the way, it is a failure. And again, so at this time, it's like there are systems in place and compliance rules and best practice again. So later date, probably someone could do an audit of the systems to see, well, were they at fault, or did they follow best practice within the industry, or was it just one of those things which was failed to be seen? Because at the end of the day, you have a certain amount of money that you can spend on your IT systems. And then within the IT systems, again, there's a certain budget you have for security and for all the risks. In the ideal world, you would have a perfect working computerized system that is mirrored somewhere else, even on the other side of the world. And if one falls, you just move to the other. And there literally are companies who drive in with container trucks where if there's a disaster, that people can walk out and start getting back onto the systems within, the hour or whatever else. But all of that requires so much money. But again, unfortunately, we're seeing the future where if systems go down, that it's gulf. It's like caveman, pen and paper, or the system works. So we're going to see probably a lot more of this in the future.
Yeah, and what then do we need to learn? Just not just the trusts, but more broadly, I suppose, as a society, with that reliance on IT for every part of our lives. And whenever it's not there, we do feel, as you say, like it's back to the Stone Age in a sense. I mean, what learnings do there need to be here?
We know everything that needs to be done. It comes down to budget. So again, just a grassroots effort maybe along the way, that maybe we find that actually that because we, the taxpayer, pay for hospitals, we pay for police, and we pay for the roads. So here's another system, and there's trust everywhere. But at the NHS, if we take it, or the HSE, that there's only a finite amount to budget. But if we find in the future that yes, that we're not getting hospital appointments, that is happening too much within there, well then hopefully the budget would increase for IT, for servicing again, and just for cybercrime, but just for maintaining IT systems again, even without the attacks, because they are extremely complex as well. But everything requires money. Even storing the data again. People wouldn't believe how much the bills are, again, because these servers do not run on free air; that they run on electricity, and that has to be paid for. Not only the computers, the computing packs, and all the systems as well. And health trusts do have. They differ from many industries, that they have to maintain all these legacy systems again, that your average hospital bed can have 10 to 15 sensors, and all of these are Internet of Things devices again with their own protocols, and generally they're cheap, off the shelves, or sometimes off the shelf. And again, the vulnerabilities can exist in them. But again, how does the IT department decide, what gets kept? In other words, that is difficult within hospitals. Again, there's so many moving parts, and they're dispersed, and then they have to integrate again with the entire health system again, as a whole, so that we can access our records from anywhere, which seems to be the ideal. But unfortunately, modern computer systems are so complex. Even your phone has 40 million lines of code running again. So it's an achievement that actually our systems work most of the time.
Yeah, well, I'm sure there are still outstanding questions that you'll be interested to hear the answers to. So too will our MLAs. Kevin Curran, a Professor of Cybersecurity from Ulster University. And I say that because the chair of the Health Committee at Stormont has said that they want to speak to the Trust and the Department of Health, question them as to how this happened and what can be done to prevent such an incident in the future.